Hello everyone. In this class, we're going to cover the concepts of anticholinergics in a simple way. Okay. So first we'll start with the definition, and then we'll move on to the classification with mnemonics, simple tricks, and we'll get into the actions of various individual drugs, and we'll discuss the uses and side effects, and we'll cover the contraindications and drug interactions of all the anticholinergics useful for your competitive exams. Okay. So here in this, what is the definition here? So here, what are anticholinergics? So anticholinergics are the drugs, they blocks the muscarinic receptors. Okay, so they competes with acetylcholine for the muscarinic receptor. So that's why they bind to this muscarinic receptor, and they able to bind, they have the affinity to bind to these receptors, but they unable to produce the effects. So that's why all the effects of acetylcholine mediated through muscarinic receptors are reduced. Okay, so anticholinergics are the drugs, they blocks all the effects of acetylcholine mediated through the muscarinic receptors. Okay, so how they what is the mechanism of action here? So here they competitively blocks the muscarinic receptor, they compete with the acetylcholine for the muscarinic receptors, so thereby they reduces the all the parasympathetic effects those are mediated through the muscarinic receptors. So here anticholinergics, these drugs also, that's why they blocks the muscarinic receptors, that's why they are also considered as muscarinic antagonist. Okay, or anti-muscarinic drugs. Okay. Along with here we also have nicotinic receptors in the parasympathetic system. So the released acetylcholine will act on the nicotinic receptors as well. But here this anticholinergics does not have any effect on the nicotinic receptor. They only blocks the muscarinic receptors. So where the muscarinic receptors are generally present on the CNS and effector organs, mostly on the effector organs and CNS. Okay, so that's why all these effects of acetylcholine on CNS and effector organs are blocked. Okay, so this is about the mechanism of action and definition of the anticholinergic. And then coming to the classification, so we'll discuss with mnemonics here, with clues, with tricks. So here coming to the classification, so basically all these anticholinergics are classified into three groups. Okay, so what are those? Those are natural alkalides, semi-synthetic alkalides, and synthetic alkalides. So these are broadly categorized into three groups. So here comes under the natural alkalides. So these here the semi-synthetic derivatives are the derivatives of these natural alkalides. Okay, so these are the purely synthetic derivatives. So here coming to the natural derivatives, examples are atropine and hyoscine. Here for the atropine and hyoscine, so they both are derived from the plant sources. So that's why the clue for this is the A hot plant. A hot plant. A is for atropine, H is for hyoscine, and plant means they are derived from plant sources. Okay, so coming to the semi-synthetic derivatives, so for them the clue is here the homoatropine, atropine methioninitrate, hyoscine butyl bromide, ipratropium bromide, and tiotropium bromide. So for all this, here the clue is happy auntie has iced tea. Okay, happy auntie has iced tea. So this is the clue for remembering semi-synthetic derivatives. So here happy, H for homoatropine, auntie, A for atropine methioninitrate, H for has for hyoscine butyl bromide, I is for ipratropium bromide, and T for tiotropium bromide. Okay, so then under the synthetic derivatives, so again these are clinically we classified these synthetic derivatives into mydriatics. Okay, so these are clinically we can classified into synthetic here mydriatics, anti-secretory and antispasmodics, and vasicoselective means they are selective only for the bladder, and anti-Parkinson drugs, central anticholinergics. Okay, so here for the mydriatics, examples are homoatropine, tropicamide, and cyclopentolate. Okay, so here homoatropine is the semi-synthetic derivative. So here the clue for this synthetic mydriatic drugs are CT reliefs, CT dilates people, CT dilates people. Okay, so here here vasicoselective means they relieve the spasms, urinary bladder, okay, overactive bladder. They are useful for the overactive bladder. How they cause the urinary retention. So here the clue is for OFT for overactive bladder. Okay, OFT for overactive bladder. So here anti-Parkinson's drug. Okay, so TPB for here trihexyphenidyl, procyclidine and piperidine. So TBP for Parkinson's disease. Okay, so here the two other remaining drugs remains in that. Those are anti-secretory, antispasmodics and tertiary amines. Okay, so these are all considered as spasmodics. They relieves the spasms, they relieves the colic and cramps and all those things. Okay, so that's why here DVP, tertiary amines, for the example DVP, dicyclomine, valentamate and piperazepine. Okay, so for all this DVP for to relieve spasms, DVP to relieve spasms. Okay, so and then here among the quaternary derivatives we have very many examples, right? So propantholin, oxyphenonium, clinidium, pipenzoate, isopropamide and glycopyrrolate. So for all this the clue is poor old clerk prefer ice creams and gulab jamun. Okay, so poor is for propantholin, O is for oxyphenonium, C is for clinidium, P is for pipenzolate and I is for isopropamide and C is for glycopyrrolate. Okay, so these are the clues to remember the classification of anticholinergics. Okay, so then here what we said until of anticholinergics are the drugs, they blocks the effects of they blocks the muscarinic receptors, right? So from preganglionic nerve endings or postganglionic nerve endings acetylcholine is released. Okay, so this acetylcholine acts on the two types of receptors, muscarinic receptors and nicotinic receptors. Here these anticholinergic drugs blocks this only the muscarinic receptors. How many muscarinic receptors we have? M1, M2, M3. Okay, so they able to block this receptor, they able to bind to this receptor, but they do not have intrinsic activity. That's why they do not produce the parasympathetic effects mediated through the muscarinic receptors. So that's why all the muscarinic effects are reduced. So generally what are the effects of these muscarinic receptors? So where the M1 is present, here M1 is present on gastric glands and CNS. Okay, so here which increases the secretions. So that's why opposite effects is produced by the anticholinergic, that reduces the gastric secretions. So here in the heart, M2 receptors generally associated with acetylcholine generally causes the decreased heart rate and decreased AV conduction. Okay, so opposite effects are produced by the anticholinergics, which increases the heart rate. So this effect is reduced. So that's why ultimately the opposite effect is produced, which increases the heart rate and which increases the AV conduction velocity. So that's why these are clinically useful in AV block. Okay, and then on the M3 receptors. So generally the M3 receptors effects are they present on the eye, smooth muscles and also on the glands. Okay, so on these three effector organs the M3 receptors are present. Okay, so actually they associated with meiosis and they associated with the contraction of ciliary muscles. Here on smooth muscle, which increases all the contractions of the smooth muscle. So here on glands, which increases all the contractions of the glands. But here anticholinergics blocks all these effects, reduces all these effects, right? So for that's why it produces mydriasis, so which causes the relaxation of the ciliary muscle. So that effect we call as cycloplegia. Okay, and which increases the secretions of all the glands and which increases the contractions of all the smooth muscles. Okay, so these are the effects of the anticholinergics. Okay, that's why here all the muscarinic muscarinic effects are reduced. So that's why all the effects are all the opposite effects are produced. Okay, so this is about the effects of the anticholinergics, common effects of the anticholinergics. Okay, then so coming to the individual drugs. So the first drug under the anticholinergics is atropine. Okay, so here, so this is the first drug. So this atropine is generally obtained from the Atropa belladonna, the plant, that is Atropa belladonna. So among these natural derivatives, L isomers are more potent. L isomers are more potent. Okay, so here coming to the atropine, so here it is a non-selective antagonist, means it blocks M1, M2 and M3 receptors, okay, which blocks all the muscarinic receptors. That's why which blocks which has effects on all the effector organs and CNS. Okay, so generally on the CNS, here we'll see clearly. So here on CNS, here which has excitatory effects on low doses and high doses, which produce the excitatory effects. Okay, which increases the which stimulates vasomotor center responsible for blood pressure control, regulation of blood pressure, which increases the vagal center. Okay, and which increases the respiratory center. Okay, all these are stimulated. Okay, and then along with that, so here in still higher doses, which produces hallucinations, delirium, and which causes the stimulation of various cortical centers. Okay, and which causes a disorientation, psychosis, and all those things. It is still higher doses. In along with that, here in the CNS, here basal ganglia. Okay, so in the basal ganglia, Parkinson's disease is because of decreased dopamine levels or increased acetylcholine activity, either increased cholinergic activity or decreased dopaminergic activity, right? So that's why here these whatever the central anticholinergics we have, they act by blocking the cholinergic activation in the basal ganglia. So that's why they are also useful in Parkinson's condition. Here atropine may have may reduces the cholinergic activation in the brain. Okay, so then along with that, here during motion, means during movement, during driving, so this motion causes the stimulation of the vestibule. Okay, so movement may stimulate the vestibule. Okay, so this once the vestibule is stimulated, so this will send the impulses to the vomiting center through the cholinergic receptors. Okay, which send impulses to the vomiting center for the emesis through the cholinergic and histamine receptors. Okay, so here vestibular stimulation and vomiting during motion during the journey is also, they blocks this cholinergic activity in the vestibule, cholinergic overstimulation, so vestibular stimulation. So that's why they are also useful in the motion sickness. Okay, what are the CNS effects? So which is useful in Parkinson's disease and which is useful in the motion sickness. Okay, so along with that, here on here which has on the glands, on heart, first we'll start with heart. Okay, on heart, here due to blockage of parasympathetic effects, okay, and due to vasomotor activity, so which increases the heart rate, but means which causes the tachycardia. But on subcutaneous injection, so which causes the initial bradycardia. So this initial bradycardia is due to the stimulation of autoreceptors, auto M2 receptors. Okay, which increases the acetylcholine release. So that's why initial bradycardia is produced on subcutaneous injection. Okay, so then here along with that, on BP, here on BP, here due to here parasympathetic effects is what, so which present on the endothelial cells and increases the release of nitrous oxide and causes vasodilation, right? So here this effect is blocked, so that's why which increases the BP. So not only due to this, so which is also due to the vasomotor stimulation. Okay, so but they have at higher doses, they have direct vasodilatory effect, and they also causes vasodilation through the histamine release. Okay, so it produce mixed effects on the BP. Okay, then so coming to the glands, so which decreases all the secretions, like which decreases the sweating, which decreases salivation, which decreases the lacrimation, and which decreases the tracheobronchial secretions, so which increases the acid release by acting on M1 receptors. Okay, so which decreases the pepsin, mucus concentration within the stomach. Everything is decreased by the atropine. Okay, so actually these are increased through parasympathetic system. Okay, so here atropine is blocking this parasympathetic effects. That's why which decreases all the secretions of the parasympathetic system glands. Okay, along with that, on the smooth muscles, so here it majorly acts on three types of smooth muscles, right? Especially on the bronchial smooth muscles, and also on ureter and uterus. Okay, ureter, uterus, and bronchial smooth muscles, and GAT muscles. Okay, and which also cause the effects on urinary bladder muscles of detrusor muscles of the bladder. Okay, so here generally, here parasympathetic system will causes the contraction of this detrusor muscle and relaxation of the sphincter. Okay, so that's why which causes the voiding, urination. But here atropine blocks this effect, which causes relaxation of detrusor muscle and contraction of the sphincter muscle. So that's why which causes the retention of urine. Okay, so which prevents the micturition. So that's why here this clinically we can use this for the enuresis, bedwetting condition. We can use this atropine. We can use atropine and the drugs acting on bladder, anticholinergics acts on bladder. Okay, for the bedwetting purpose. Okay, neurogenic bladder and enuresis problems, for everything we can use this drug. Okay, and then involuntary urination, to stop involuntary urination we can use atropine. Okay, along with that, here which also here normally parasympathetic system causes bronchoconstriction. Okay, so here the difference between parasympathetic and sympathetic system, here muscarinic receptors, M3 receptors are present on the major blood vessels, major bronchioles. Okay, major airways. So whereas sympathetic receptors are present on the beta 2 receptors are present on the smaller airways, resistant airways. Okay, so here by blocking these M3 receptors, which causes the dilation of these larger airways. Okay, so that's why instead of using for asthma, we can use these drugs for the COPD. Okay, along with that, not only here for asthma, the onset of action of anticholinergics is slow. Okay, so that's why we cannot use for prevention of the asthma attacks. We can use for the chronic prophylaxis. Okay, and then coming to the intestinal muscles, here here which decreases the spasms, contractions of the entire intestine. Okay, so entire GA tract. So that's why which causes constipation. Okay, constipation. So that's why it is useful in the conditions of diarrhea. Okay, so which is useful in to relieve the spasms, intestinal or esophageal spasms, and which is useful for controlling the gastritis, inflammatory bowel disease. Okay, and to control the for all these things we can for control the colic pains. Okay, due to spasms, due to contractions, so cramps due to contractions. Okay, for all these things we can use the atropine because it relieves the spasms. Okay, uh, these are the effects on smooth muscles. Okay, along with that, here which decreases the glandular secretions, which decreases the smooth muscle contractions, which blocks the vestibular stimulation and ganglionic stimulation at basal ganglia, stimulation of cholinergic activity in basal ganglia, and then we'll see the effects on eye. Okay, so generally here parasympathetic system and sympathetic system. Okay, so in parasympathetic system, so here iris muscles are two types. So one are the circular muscles and another one is the radial muscles. Okay, radial muscles here. So these circular muscles we consider as the sphincter pupil, which is responsible for contraction of the pupil. Okay, and these radial muscles we considered as the dilator pupil. Okay, so which is contraction of which causes the dilation of the pupil. Here generally the parasympathetic system causes this contraction of the circular muscles, sphincter pupil, and causes the meiosis. But here atropine blocks these effects. Means what? Which do not have any effect on the dilator pupil, but which relaxes the sphincter pupil. So that's why they causes the mydriasis. So without having effect on the dilator pupil, through the relaxation of circular muscles, which causes the mydriasis. Okay, these are the effects on eye. So along with that, here which causes the fever, increases the body temperature, atropine fever. So which is either due to decreased sweating or which directly stimulate the thermoregulatory center. Okay, and which also have anesthetic action on the cornea. Okay, so generally here these drugs due to decreased because these drugs are decreasing the secretions, like so tracheobronchial secretions, which decreases the GI secretions and all those, right? So that's why these are useful as pre-anesthetic medication. Before anesthesia, to decrease the secretions, we can use these drugs as a pre-anesthetic medication. So in that especially we use glycopyrrolate for the glycopyrrolate as a pre-anesthetic medication. Okay, so this is all regarding the actions of atropine. Okay, so then we'll discuss the effects of an individual drugs. So here, being a non-selective antagonist, so atropine has all these effects because they have all the effects on they can block M1, M2 and M3 receptor. So that's why they have effect on CNS. They decrease the acid secretion and they decrease the they increase the AV conduction and increase the heart rate, and which increases the smooth muscle contractions, which increases the secretions, glandular secretions, which has effect on eye, which cause mydriasis and which cause cycloplegia and everything, right? So remaining anticholinergics, so they selectively acts only on the bladder. Some will selectively acts only on the bladder. Some will selectively acts only on the intestine. Okay, some will selectively acts only on the eye. Okay, so that's why each drug has an individual uses and individual effects. Okay, so that we'll discuss in this class. Okay, so first we'll start with the semi-synthetic derivatives. Okay, what we have in semi-synthetic derivatives. So here one more natural alkaloid is there, right? So what is that? So here one more natural alkaloid is hyoscine. Okay, so here hyoscine we can obtain from the Hyoscyamus niger. Like here in case of atropine, which has more effects on the smooth muscles and heart, whereas hyoscine, which has more effects on the glands and eye. Okay, and stimulation of vestibular stimulation is blocked less by the atropine, more by the hyoscine, because which penetrates the brain and which has more effects on the which blocks the vestibular stimulation. That's why which is more effective in the motion sickness. Hyoscine we can use in motion sickness. Okay, and then here along with that, here atropine, which has excitatory effects on the CNS. So whereas hyoscine have inhibitory effects on the CNS, so which cause sedation and drowsiness and all these things. So that's why which is useful to induce amnesia or sedation in case of surgeries. Okay, so for that purposes we can use. Okay, so lower doses which causes depression and higher doses which causes the excitation, CNS excitation. Okay, so this is about the natural alkaloids, and then we have semi-synthetic alkaloids. So among that, here homatropine. Homatropin we can use for used as a mydriatic. Homatropin we can used as mydriatic, but the onset of action is about 40 to 60 minutes is long to produce the mydriasis and cycloplegia, so which takes longer time, and then the effects are lost after 1 to 3 days. So, okay, so that's why the remaining latter anticholinergic drugs we can use for the for these purposes here, especially so where we require this mydriasis and pupil dilation in fundoscopy to see the internal structures, examination of internal structures like macula densa, for the retina, for examination of these internal structures of the eye, pupil has to be dilated. Okay, so in such conditions we can use these drugs. In what purpose? For the examination, fundoscopy. Okay, and for the refractory testings. Okay, so generally in which purposes we require contractions of the, here iris muscle contraction, pupil contraction is required, pupil is constricted during the light. Okay, and then pupil is dilated during the dim light, right? Okay, so here for the near vision, ciliary muscle has to contract, and we have to lens has to be more curved. Okay, so in that we focus the near objects, we can focus the near objects. Okay, so here in case of ciliary muscle has to relax in case of far vision. Okay, so that's why here by blocking these effects, so here it is useful in the refractory testing. Okay, in which is useful to test the for vision testing, we can use these drugs to correct the, to know the exact refractory problems we have, what we have. So to assess that, we can use these drugs to avoid the over focusing for near vision and everything. We can use these drugs. Okay, along with that, so by causing the contraction of relaxation of the ciliary muscle, which causes the blurring of the far vision, which causes blurring of near vision, and so which also causes the photophobia. Okay, and these are the side effects associated with the anticholinergics. Okay, and then so coming to the individual drugs, here first we'll start with the semisynthetics. Okay, here hyoscine butyl bromide and atropine methionine. So these are especially we can use for GAT conditions like abdominal colic and hyperacidity, and esophageal and gastrointestinal spastic conditions we can use. So these two drugs, ipratropium bromide and tiotropium bromide, so we selectively use, they selectively acts on the bronchioles, so that's why we can use for bronchial asthma and COPD conditions. Okay, among that this tiotropium bromide is selective M1 and M3 blocker, so which do not have any anticholinergic side effects. So whereas ipratropium bromide, some drug will absorbed into the blood. Okay, so that's why which produce some side effects like which cause cough and throat infection, dryness in the mouth and nervousness. Okay, and but these two we can use for the M3 blockers, we can use for the asthma and COPD. Okay, then here synthetic among the synthetic, we have mydriatics like cyclopentolate and tropicamide. Okay, so before these synthetic drugs, so here atropine and natural atropine and semi-synthetic homatropine are also the potent mydriatics. So but the duration for producing, onset of action is slow. It takes almost 3 to 6 hours to produce the effect, 2 to 3 hours to produce the effect in case of atropine, and takes 45 to 60, 1 hour to produce this effect, and the effects last longer. Okay, so in case of atropine, it lasts after 1 week. means blood division, and then all these things are last for about 1 week. So here in case of homatropin also, these effects last for 1 to 3 days, and it does not produce any sufficient cycloplegia in case of children. So that's why we can go for this cyclopentolate and tropicamide. But this cyclopentolate also causes the this can absorb from the nasolacrimal duct, so that's why which may cause the behavioral abnormalities in children. Okay, so that's why we can use tropicamide. Here tropicamide is rapidly acting drug, and which has a briefer onset of action, briefer duration of action. Okay, so the duration of action is only for 3 to 6 hours. So that's why, so we prefer tropicamide for the tropicamide as a mydriatic, as well as cycloplegic for the refractory testing and fundoscopy. Okay, so then vasoselective drugs. So here vasoselective drugs, they selectively acts on the bladder. Okay, here which acts on M1 and M3 receptors, oxybutanin, and here which acts on the salivary glands and bladder. Okay, here which is useful in the urinary urgency conditions like nocturnal enuresis, spina bifida, neurogenic bladder, and all these conditions are associated with the involuntary urination. To control that, we can use this oxybutanin. Okay, but it has a anticholinergic side effects because it acts on both the M1 and M3 receptors, right? So that's why we can go for tolteridone and flavoxate. They selectively blocks the M3 receptor, and they have more selective for the bladder. So that's why, so because of less antimuscarinic effects, we can go with tolteridone and flavoxate. Okay, so here then, so among the synthetic, we have quaternary ammonium derivatives and tertiary ammonium derivatives as an antisecretory and antispasmodic drugs. Okay, so among that, so here this glycopyrrolate, initially we said this glycopyrrolate is as an antisecretory, so we can use in pre-anesthetic medication to reduce the tracheobronchial secretions and all those things. We can use in a used as a pre-anesthetic medication. Okay, so here, so remaining these three, clinidium, piperacillate and isopropamate as an antispasmodic. So we can use this in peptic ulcer conditions to reduce which acts by reducing gastric secretions and spasms, and irritable bowel syndrome, nervous dyspepsia, gastritis, to relieve the abdominal cramps. Okay, to relieve the infant colic pains, cramps due to spasms. Okay, everything we can we use all these three drugs here. So whereas propantholin and oxyphenonium we can use for peptic ulcer and gastritis. Okay, so then among the antispasmodic antisecretory, we have tertiary amines as well. Okay, so among that, pyrangiapine we can only use for peptic ulcer, which is selectively blocks the M1 receptors. Here dicyclomine, which blocks the vestibular stimulation. So as like hyoscine, which blocks the vestibular stimulation. So that's why which is useful in the motion sickness. Apart from motion sickness, we can also use this drug in dysmenorrhea and inflammatory bowel syndrome. Okay, so here valinthomate, so it is a visceral antispasmodic. So that's why, so not only to control the intestinal colic, for the cervix, renal and biliary colic conditions also we can go for the valinthomate. Okay, so this is regarding the individual drugs. Okay, so among that, we'll continue with the uses of anticholinergics. So coming to the uses, so here which has many effects, right, which acts as anti-secretory drugs, and which cause bronchodilation, which prevents the urinary retention, and which has mydriatic effect, and which is used as antispasmodic, and which decreases the AV conduction. Okay, so because of that, we can use these drugs for various therapeutic purposes. Okay, so then we'll see as an anti-secretory. Okay, by reducing the acid secretion, which is useful this drug for hyperacidity and peptic ulcers. Okay, and as an anti-secretory, which decreases the tracheobronchial secretions due to anesthetics. So that's why we can use this for as a pre-anesthetic medication. Okay, and then embolism. Embolism is nothing but moving clot. So this will causes the uh, increased pulmonary secretions. So these secretions due to pulmonary secretions due to embolism is also decreased by the anticholinergics. That's why it is also useful in pulmonary embolism. So as an antispasmodic, okay. So all the before one are due to antisecretory effects. Okay, as an antispasmodic, so we can use this drug to control diarrhea. Okay, due to excess contractions, diarrhea. To control the diarrhea we can use, and also to control the spastic constipation, constipation due to increased spasms, spastic constipation. Okay, and we can also useful for to control the colic, to control the uh, cramps due to spasms or due to obstructions. So for this we can use this in the renal colic, in the biliary colic. So in case of intestinal colic, in the all this colic pain we can use these drugs. Okay, and then for the inflammatory bowel syndrome, as antisecretory and antispasmodic we can use in this condition, and we can also useful for gastritis. Okay, and for all these conditions we can use this anticholinergics. Then as a bronchodilator, so as a bronchodilator we can useful for bronchial asthma as well as for the COPD. Okay, along with that, which as on heart which decreases the AV conduction, which increases the AV conduction velocity, right? So which increases the AV conduction velocity and heart rate. Okay, so due to increased AV conduction velocity we can use in AV block. Okay, arrhythmias condition, AV block condition, we can use this drug. Okay, and then as a cardiac coagulatic we can use this in AV block. Okay, along with that, as a mydriatic, as a mydriatic encycloplegic. Okay, so which is useful for refractory testing and also for the fundoscopy. Okay, and which is also used as in mydriatic. So these are for examination, and we can also use for to control the iritis, to control the uh, corneal ulcerations, choroiditis. Okay, so for all these conditions we can use these mydriatics. Okay, then bladder, on bladder, so to relieve enuresis, spina bifida, neural nervous neurogenic bladder, in all these conditions we can use for we can use anticholinergics to prevent the involuntary urination, to control the bedwetting we can use these drugs. Okay, and then for the we can use for antidote, we can use for used it as an antidote for various conditions, like various drugs, antidote for cholinesterase poisoning and muscarine poisoning and all these things we can use these drugs. Okay, so these are the uses of anticholinergics. So coming to the side effects here, so all these side effects due to excess pharmacological activity. Okay, so in excess decrease in salivation, sweating and all these will causes the dryness of mouth, dryness of nose. Okay, so dryness of uh, skin and all those things. Okay, along with that, which causes the difficulty in micturition. Okay, which increases the, which causes hot flares. Okay, and scarlet fever, sunburn like sunburn like rashes, scarlet rash on the body. Okay, and along with that, due to decreased spasms, intestinal spasms, which causes the constipation. Okay, and then due to blurred vision, which causes blurred vision, due to cycloplegia and mydriasis, which cause and which increases the intraocular pressure, especially in narrow angle glaucoma. So that's very contraindicated in such cases. Okay, and so these are the side effects. CNS, excess CNS side effects like hallucinations, and which cause delirium and all those side effects. So these are the side effects of the anticholinergics. Okay, so then coming to the here, the clues for the side effects are, so here dry, which cause dry mouth, difficulty in swallowing, here flushed skin, decreased bowel sounds, and difficulty in micturition. Okay, and then heart, which increases the temperature and cause scarlet rash. Okay, so blind, which cause photophobia and blurring of near vision. Okay, fast, which increases the heart rate and all this, that's why it causes palpitation, and which cause direct vasodilatory effect, that's why it causes hypotension. Okay, and on CNS, which cause ataxia. Okay, lack of balance and delirium, hallucinations, excitement and psychotic behavior and everything. Okay, so this is called mad. Okay, so all these are the side effects of the anticholinergics. Okay, so then coming to the contraindications. Here, uh, which cause mydriasis, that's why which is not suitable in a narrow angle glaucoma. Okay, so which precipitate the glaucoma. Okay, so then in the elderly individual and in post prostate hypertrophy, so difficulty in micturition. Okay, so in such cases also we can avoid this drug, so which cause further urinary, which increases the urinary incontinence. Okay, so then urinary urgency, in such cases we can avoid this drug. Okay, and then here atropine, which by reducing the intestinal contractions, which decreases the absorption of many drugs, which increases the gastric emptying and decreases the absorption of many drugs. Anticholinergics absorption is decreased by antacids and MAO inhibitors. MAO is responsible for the metabolism of anticholinergics in the brain. Okay, so that's why MAO inhibitors uh, increases the concentration of anticholinergics in the brain and increases the delirium and all those side effects. Okay, and then here MAO is responsible for metabolism, so that's why MAO inhibitors inhibits the metabolism of anticholinergics in the brain. Okay, these antihistamines, tricyclic antidepressants, and phenothiazine, disopyramide, and pethidine, and all these things have additional anticholinergic activity. They have anticholinergic activity, so that's why all these drugs will potentiate the anticholinergic effects of the anticholinergics. Okay, so these are the contraindications and drug interactions.